Hello, today we will be reviewing the mechanism of breast pump milk extraction by looking at breast pump milk flow compared to natural breastfeeding milk flow. This will be done by examining the Womersley number to determine if breast pumps accurately mimic the flow pattern seen in breastfeeding. So what is a breast pump? A breast pump is a medical device that can be used in any setting to extract milk from the breast for future feeding. The use of a breast pump has become increasingly popular since many times breastfeeding is not an option. This is true for mothers who work outside the home, babies that may be sick or in the NICU, babies that are unable to latch and suckle properly, and infants who are separated from their mothers. Here you see the anatomy of how breast milk is extracted while breastfeeding, where the child's mouth is latched onto the mother's teat. Milk is expressed via lactiferous sinuses as highlighted in yellow. The milk from the lactiferous sinuses is expelled via the mother's teat as highlighted in green. The milk is expelled into the oropharynx of the infant as highlighted in red, where it is then swallowed.
There are three phases of natural breastfeeding. The first phase of breastfeeding is the milk ejection reflex. This reflex causes the active expulsion of milk with little to no involvement on the part of the infant. After the initial reflex subsides, it helps to maintain positive pressure within the lactiferous sinus system for future milk extraction. The second phase of breastfeeding is the nutritive feeding. This process requires the active suckling of the infant to extract milk. This is a slower feeding, approximately 1 cycle per second. During this phase, the infant obtains the most nutrition and the majority of the milk is extracted from the breast. The third and final phase of breastfeeding is the non-nutritive suckling. This is a faster feeding as compared to nutritive feeding with a frequency of approximately 2 cycles per second. This phase exhibits a comforting and calming action for the baby where little to no breast milk is extracted. The suckling cycle consists of an exchange of positive and negative pressure. This exchange of pressure is what drives milk extraction from the mother's breast into the infant's mouth. The positive pressure is supplied via the milk ejection reflex previously discussed. As stated before, this reflex is what keeps the breast sinuses filled with milk and ready for extraction by the infant. The negative pressure comes from the suckling of the infant when the tongue applies pressure to the nipple and soft palate, producing suction on the teat. This exchange of positive and negative pressure is also seen in breast pumps, where the positive pressure is still supplied via the letdown reflex and the negative pressure is supplied via the suction of the pump.
We calculated the Womersley number of the natural flow experienced via breastfeeding and compared it to the flow of milk seen in a breast pump. The dimensionless Womersley number, alpha, characterizes the nature of unsteady flow, specifically examining if the flow profile is parabolic or flat. The equation to determine the Womersley number is shown here. If the Womersley number is less than 1, the flow is more parabolic, meaning it is more of a consistent stream with less pulsatility. If the Womersley number is greater than 10, the flow is flat, meaning more pulsatile and non-constant. Here, the Womersley number was calculated for natural breastfeeding. The values used to calculate alpha were found in existing literature. From this calculation, the Womersley number was determined to be 23.1. Here, the Womersley number was calculated for a breast pump. The characteristic length is the radius of the breast pump's nipple shield and the frequency range depending on speed. The other parameters remain the same. From this calculation, the Womersley number ranged from 12.9 to 27.2 depending on size and speed of the pump. From this analysis, the breast pump can mimic the flow seen in natural breastfeeding. Both natural breastfeeding and the use of a breast pump result in pulsatile flow. It is evident that sizing and speed play a crucial role in determining the natural flow of breast milk when using a breast pump. Smaller nipple shields sizes can result in reduced flow due to clogged or pinched milk ducts, while larger sizes can result in too much suction of the breast tissue, leading to longer extraction times. Higher speeds can cause increased discomfort for the mother. This discomfort decreases the milk ejection reflex, thus making it more difficult to maintain positive pressure. To optimize the pump to most closely mimic natural breastfeeding, it would be ideal to implement an automatic cyclic change in speed from high to low throughout the extraction. Higher speeds for a shorter period of time would help initiate the milk ejection reflex, while lower speeds for longer periods of time would help mimic the nutritive phase of the feeding cycle. Additionally, breast pumps could come with custom molded nipple shields to result in the best fit and greatest efficiency of milk extraction.